Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hi, everybody. Welcome to this week's edition of The Holistic Nurse with Peggy Smith. Today, we're going to be talking about one of the oldest modalities. We've talked about them before a few times, but it still seems to be a mystery to so many people. We're going to be talking on the topic of hypnosis because many people don't realize that hypnosis is actually something that is something that you can do for yourself once you learn the skills. I'd like to welcome as my guest today, Gloria Warren. She's a fellow holistic practitioner. Hi, Gloria. How are you?
Hi. Good. Glad to be here.
And she's going to help share why this is such an accessible tool for people at a time that every tool counts, to get through our stresses in our daily lives. Hypnosis can be a very supportive therapy, but it's just actually a skill. It's not something that is done to a client. It's something that we teach you how to do for yourself. Gloria, maybe you want to explain a little bit what we mean by self-hypnosis as opposed to regular hypnosis?
Well, very simplistically stated, self-hypnosis can be done by yourself at home in the comfort of your home. You know, if you're driving in the car and things are going crazy in your head and you just want to, be more focused on driving, you can always pull over your car and do some self-hypnosis for yourself and then get back on the road. And it helps in many areas of your life, and it can be done by yourself as opposed to a professional, of course. A professional can do it with you. And perhaps the professional would have many other ideas for you and take care of your situation in a quicker and easier fashion. So there's a choice involved there.
Well, one of the many purposes that stress can help be alleviated with hypnosis. It helps you increase your relaxation skills, which lowers your stress. If you lower your stress, then your blood pressure goes down. Some of your other medical problems, maybe if you have a really high heart rate, just because you're constantly in that fight or flight mode at life, work is, fight or flight, or you might not have a job, and traffic is, gosh, wish I had a helicopter like the Jetsons, to get to work. And there's just so many things that we can't control. But Gloria, you made a good point. A lot of these self-help hypnosis things, especially the apps they have on the phone, should not be done while you're driving.
Right. There's scripts that you can find online. And, the scripts are basically, make yourself comfortable now, take a slow, deep breath, and things you tell yourself. Take a slow, deep breath in and out, and they do it again. And you hold your breath for like 4 to 6 seconds, but you count with it, and then you slowly let it out. And then there's different scripts that you can use for the hypnosis, which is very beneficial depending on your situation.
Sometimes the basis for most of them starts off with a progressive relaxation technique. And sometimes that's really what you need more than anything else, is just to, bring it down a notch, lower the stress consciously, so that you don't feel like you're a victim of everything that's causing the stress. It also helps promote healthier sleep patterns. And a lot of us, I don't know when, I guess when families started getting two or three TVs in the house, then everybody's bedroom had a TV. Having the TV and the electronics on, it's not even TVs anymore. Most kids go to bed with their phones and their tablets. And It
Oh,
makes it really next to impossible to just wind
yeah.
down because your mind gets all those electronic blue light transmissions, and
Hmm.
you never really go into a deep, restful sleep, which means that you're going to start the next day really stressed out. If you're a high school student, and a lot of these high school kids have to be on the school bus by 6:30 in the morning, and most teenagers that I know, they were sleeping till 11 in the summer. It's hard to get back up to a 6:30 in the morning thing.
Hmm.
And another good tool that hypnosis helps with is pain management. Um, when
Right.
you're when you're really stressed, like cancer patients often report that their pain is worse at nighttime. And it's not necessarily that it's worse, but you're aware of it. You have a heightened awareness because you don't have all the distractions that you would
Right.
have in the daytime. If you're able to stay busy and maybe enjoy your dog or your grandkids, you you're not focused on yourself and the pain. But when everybody leaves and the house is quiet, that's when you realize, oh my gosh, this pain is unbearable. Uh,
Right.
and
Especially
yeah,
after surgery, even, I'm sure you've
yeah,
seen where you can use self-hypnosis to help yourself after surgery.
you
So,
can also use self hypnosis to prepare for surgery. If it's an
oh,
elective
good point.
surgery, you know you're going
The
to need your
rehabilitation.
knee
Yeah.
replaced. You can get yourself in a good frame of mind so that so you have a better outcome. And there's
You're right.
evidence-based practice that shows that patients that prepare for surgery that way, especially like I remember in nursing school, and I'll never forget this teacher. It was the pediatric instructor, and we were talking about surgeries in general and general anesthesia. And for whatever happened to this teacher in her history, she had a negative reaction to general anesthesia.
Mm.
It just happened the very next day after that class, I had emergency surgery. And as I was going under the anesthesia, I heard my instructor Harriet saying, never give me general, never give me general. And that was playing in my head over and over, not intentionally. That's just what I heard.
Right.
And I actually had trouble getting out of the anesthesia and had temporarily been on a ventilator because I was having so much trouble. For like 10 hours, they couldn't get me off the ventilator. And
Mhm.
I never had problems with anesthesia prior to that. I really believe that mind body connection was so strong. I mean, it is strong, but in that case, me not even realizing it, and I was not very knowledgeable about holistic principles at that time. But because I had heard that before I went into surgery, I reacted in the way that I did. And you can take those negative reactions with self hypnosis and prepare yourself. You can say, I have confidence in my doctor. I know that this will make me a healthier person. Um, you know,
Right.
the I'm
A good
so grateful.
emotional and mental health support for
Uh,
prior to surgery, which I've
Doing
never
it,
used it for that. I'm so glad you mentioned that, though. I'm sure
yeah.
a
It's
lot of
also
my viewers.
used for everybody knows about Lamaze and pregnancy and things, but
Mhm.
they also do hypnosis for childbirth. Obviously, before you get there, to train yourself so that
Yeah.
you know how to find that focal point and focus your breathing because you're doing that. Excuse me, but there's so much that you can do to prepare for these surgeries, these medical
Mhm.
procedures. And it's really scary because you're not only worried about a good outcome in the surgery, and that's normal. You're also worried about, gosh, how much work am I going to miss, and then I'm going to have more stress because I can't meet the bills. Your
Yeah,
mind just goes down like an avalanche, and you can
right.
use thought stopping techniques, which you can learn with self hypnosis to say, okay, is that really a realistic fear? I'm going to have a positive recovery. It's going to go well. And
Mhm.
it does a lot um, to help. And they find that people that use hypnosis prior to surgery end up needing less pain medicine after surgery.
Yeah, it
So
it 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 helps with pain in general, even chronic pain. I would mention to my patients about chronic pain, the ones that get a lot of migraines, arthritis, although they can try to, mitigate some of these situations while they're even in the mitigation process, self-hypnosis can be extremely beneficial with chronic pain, um, as well as after surgery, post-surgical procedures.
And I think we should touch on autoimmune disorders because that is becoming probably the most common class of
Yeah,
illnesses and medical concerns these days.
right.
Whether it's our environment or the foods or whatever it is, we do seem to have more people dealing with and not just people. I have two dogs with autoimmune disorders, and they don't have a brain that's talking them into it. I mean, these are real
Ah,
problems, and
oh,
probably
you were telling me about that earlier. You should let our viewers know about that. It was really
yeah.
interesting.
Yeah, my piglet has an autoimmune disorder. She's allergic to herself, and there are people that are allergic to themselves of sort. That's a
Hmm.
very generalistic, simplistic way of saying it. Uh, I remember when I was growing up, everybody talked about the boy in a bubble. It was a young boy in Texas that had he's so protected. Literally,
Hmm.
he was living in a bubble to keep catching everything. What we know now through immune globulin medications that are available and other ways to, different techniques with research, we've learned that we can build up the immune system, um, with modern medicine that makes these side effects of having, you still have the issue. If you're prone to autoimmune diseases, chances are you're still going to have them, but you can manage them and manage the symptoms. And hypnosis is just one of the tools that help you do that. Um, you know, a lot of people use hypnosis for sports performance, um,
Hmm.
or test anxiety. If you're getting ready to take an important exam, an entrance exam to law school or something like that, and this is going to be it. And instead of focusing on what's going to happen if I fail, because the universe doesn't hear what if I fail, they just hear the
Yeah,
last part, I fail. And
right.
the universe really tries to please. So if you're having those what if thoughts, you can retrain your brain to block those thoughts and say, what do you mean, what if I thought, we're going to do this, we got it, but if I don't, for some reason, it's not the end of the world. We have options. And,
Right. And I'm sorry.
yeah, no, go ahead.
I was thinking when you said for pre-test and things of that nature, the emotional and mental health, it can not just reduce anxiety and support depression, but also in performance enhancement. It improves the focus prior to test taking. And there's scientific research that actually supports the memory is improved with doing one of the self-hypnosis um, relaxation techniques. So it does help with test taking and public speaking, athletic performance, even some of those. I watched a football game the other day, and they were saying about how they're using psychiatrists and psychologists and social workers and hypnotists and baseball players are using it to get themselves to relax when they get up to the base when they need to hit. And it was actually, there's a guru even in California that does just this for sports professionals. So there's so many different reasons, and all of these things are actually supported by extensive clinical research. And if anybody needs that list, I'm sure Nurse Peggy could actually send that to them. So you just
Yeah.
contact or put in comments, and she can get that to you.
Yeah, a lot of people with similar to test anxiety, if you're at a grade school or high school level sports, and you have so much pressure, especially if you're trying to please a parent, who's trying to relive his life through
Mhm.
you, and that's a lot of pressure on a kid. Um,
Right.
I try to encourage those kids to be the best they can, but it's okay if maybe the best wasn't good enough for that time. There's other it's not like a one and done, and might be something else that you're better at that you find out, in the process.
Right.
Excuse me.
So in general, though, self-hypnosis can be a very valuable tool for managing stress, healing, pre-op, post-op situations as well, and personal growth. Works as a complement to medical care, healthy lifestyle habits, and professional guidance. By the way, make sure to check with your medical professional too, perhaps not only just letting them know, and perhaps they can give you some optimization things for your own medical plan. Nurse Peggy, though, is a hypnotist. So she has been doing this many years. And God, when I found that out, I'm like, oh, this is fantastic. Now I have my resource. So we could all use a little bit of self-hypnosis from time to time. So we're
Well,
happy about that.
one of the things that I mean, I was convinced in the beginning that I was one of those people that couldn't be hypnotized. And
Right.
so many people feel that way. And you don't realize that we're being hypnotized every day. Every time you see a commercial, you're being hypnotized. And, you notice that maybe around dinner times, there'll be commercials for foods that all of a sudden you're hungry and you weren't
Mhm.
hungry 5 minutes before the commercial. They're already starting for the, Christmas commercials, and,
Oh,
and, and
Black Friday.
so we're being hypnotized every day. And
Yeah.
I have found in my experience that the people that think they are impossible to hypnotize are actually the best candidates, because I think on some level you almost know that you're being hypnotized all the time, and maybe you have a level of resentment, or you feel like something else is controlling you. Hypnosis is not any kind of mind control. It's actually
Right.
just the opposite.
Exactly. It's different levels of hypnosis. There's just a power of suggestion is actually a type of hypnosis. And then you have your self-hypnosis where you can lay there and you can relax and you can go from your toes on up and do things to help your stress levels and pain and things of that nature. But then there's that deep hypnosis that you don't really you may try to seek a professional to put you under a deep hypnosis, and that's a whole nother ballpark, which we will discuss. But I did want to touch base a little bit more on the immunity. You had mentioned immune types of disorders, and
Right.
I just wanted to mention some of those, not just stress and anxiety, but chronic pain. And irritable bowel syndrome is a good candidate for that,
That's
and
an excellent one. Yes. Yeah.
autoimmune conditions that may have symptoms of fatigue and bloating, constipation, diarrhea, and gut. You need your gut relaxation techniques and things like that. Autoimmune conditions of various types, and the sleep disorders, of course. Skin conditions. This is an area that you don't hear it much about it, but sometimes skin conditions are a sign of stress. So using the self-hypnosis could actually alleviate some of the skin conditions such as acne, psoriasis, eczema. Even even they found that warts, because stress lowers your immunity, and then all different types of HPV, all different there's different ones there, of course, can be but they can be suppressed with your immunity. But if your immunity is low, then things tend to come out like warts and things. Also habits. Everyone knows, people hear it all the time. And I'm sure you have, Peggy, definitely.
Yes.
Smoking. You want to stop smoking. You want to maintain your weight and other habits of that nature. That is the perfect thing to start with self-hypnosis. And then you may then want to seek a professional for that as well. So,
Well, in addition to the traditional smoking, and now we have vaping issues, which, from a health standpoint, are much worse
mhm,
than smoking cigarettes.
right.
And there's lots of research, to support that. Um,
Yes. All
there's
those bad,
lots,
nasty habits.
you know, uh, you know, very few people have that ideal, perfect, lifestyle, that we eat the right foods, and, blood sugars are always controlled, and, our weight is perfect. And it's hypnosis can also be used because everybody's not a Barbie doll, and that doesn't mean you're
Mhm.
defective. So it can be used to actually learn to accept yourself and love yourself. And a lot of times, a lot of our issues, no matter how they're manifested in physical symptoms, it just comes from some level of feeling inadequate, something we learned in childhood or somewhere along the way. You know,
Hmm.
well-meaning relatives, I've heard them say to their grandkids or nieces and nephews, and oh, you'll never be anything, and
Uh,
they don't even mean it in a malicious way. It's just the way they were raised, and they're acting. There's always that point where we turn into our mothers, and you're horrified when you realize I just turned into my mother, but it's part of being human. But just because you hear things and you're programmed in a certain way doesn't mean you can't reprogram yourself. And that's a
right,
lot, especially with the autoimmune disorders. You're not
right.
committed to a life of just dysfunction and handicap because you were born this way. Maybe you can't change some of the basic issues you have, but you can certainly change your attitude toward it.
Right. Especially if you have like a dysfunctional family, you're living in a dysfunctional family scenario, which I mean, who isn't to a certain extent?
To say
But
that, yeah.
yeah, but it really self-hypnosis, I found in my situations in life, it really has been something I lean on because it helps me to practice this Zen type moment where it regrounds me, and that way there I can mentally and physically continue on and try to function in life in a more normal level. And it's been a godsend. It really has. And that's why like I said, when I heard about Nurse Peggy, I was like, oh my God, this is great, because I'm sure I can learn so much more from her.
Well, I
Thank
found
you.
over the years that there's, yeah, I mean, it's almost, you almost laugh at it when you realize how much of our programming that we're even blaming on our ancestors or, primary
Family.
family. It's actually things, if you really have an aware level of self-awareness, you realize that you kind of did it to yourself many times. There's a lot of
Hmm.
kids will put pressure on themselves to perform, and the family's not that high pressure, but the kid just perceives that they've got to do it or they're somehow defective. We're going to take a
Right.
brief break right now, and we'll be back in a few minutes. Pick up from here. Thank you.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to easysense.com and learn how, with your help, we can fight these horrific brain disorders. That's easysense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Hi, welcome back. We're talking with Dr. Gloria Warren about hypnosis this episode. One of the most helpful for me with self-hypnosis over the years. I am not a fan of dentists. I don't know. There are actually people that are.
Oh, we love them.
They do have the highest suicide rate, unfortunately. So I suspect I'm not the only one. But in order to get me to get to the dentist, I have to really do some self-hypnosis to calm down. And once I'm in the chair, then it's got to continue. And I had one experience where I don't know if he was a new dentist or young, or he was just as nervous as I was, but he wouldn't stop talking. And I was trying to go to my happy place. So that's kind of like a trip. When you get really good at practicing self-hypnosis, what takes you maybe 15 minutes, you could almost do it in 3 minutes. Your mind anticipates the relaxation response. And this guy would not stop talking. And I was trying to get to my happy place. And I finally said, would you please shut up? I'm trying to go to my happy place. But, you actually use less pain medicine, less anesthesia, and you have better outcomes. And it's, on every time, it's a non-medical procedure. For very complicated emotional problems, it's good to be with a professional in person, because as they take you to a deeper level of relaxation. And really, that's all hypnosis is. It's a very deep level of relaxation, because when your mind is totally relaxed, then you can access your subconscious mind, and that's where you can plant ideas that will carry you through when you're alert again and out of this relaxation state. Hypnosis is also used for past life regression, and for some people that's a little bit controversial. There's more and more evidence-based practice, though, that there's something to this field. It's not something that you should do on your own. You should seek a professional that specializes in past life regression. I really can't think of anything that would not be safe with hypnosis, unless there were just a lot of extraneous issues going on that, for instance, somebody with a dissociative disorder has been hypnotizing themselves their entire life. And it's possible that you could cause an abreaction. And, if you're not a professional mental health provider, you're not able to actually handle that in a safe way for the person.
Yes.
So,
you bring up a really big scenario out there in the public, and somebody always knows somebody that has a problem with their psyche. I just want to say this message in that topic of this show. You're not alone. You're not broken. There is a handout that we can send to you. Please, put your information in the comments on YouTube, and we will get that to you. Your body will listen to every word you say. So speak it lovingly. And I have a really fast little type of meditation that you can say to yourself. And it's simple. It's an imagery practice. It's the first thing you would do is sit or lay down, get comfortable, close your eyes, breathe in deeply. On the exhale, imagine a warm golden light flowing through your body. Picture your immune system, your mind, and all the guardians around you, balancing, listening, protecting you, giving you peace of mind. And stay there for like 5 to 10 minutes. And always, whenever you do a self-hypnosis scenario, end with gratitude. It's something that mental health is so important in today's world. There are so many people that need extra support, and this is why Nurse Peggy does what she does. And it gives us extra support, not just for pain and physical diagnosis and, disease buckets or whatever. It is also for mental health. and overall mental health. And let's say you don't have schizophrenia, or let's say you're not manic depressive, but you just need some mental health to get away from, maybe you got little kids, maybe you just had a confrontation with your boss, maybe you just need a little time to get away, 5 minutes, 10 minutes. It can be done on a break. It's that simple. It really can ground you if you allow it to. And nobody's telling you what to think. Nobody's telling you what to do. This is within you. Follow your inner peace and your inner guides so that you get that grounding you need to get through your days. It works, it helps. Of course, if there's some major problems, you should seek other help. It's obvious. When you need a social worker or a psychologist or psychiatrist, please seek that out. But in the meantime, you can do these things to help bridge the gap. And maybe this is all you need. Maybe it isn't, but it gives you something to help for now. Okay? So a lot of benefits, though, like we
Well,
would
I
say.
noticed that while driving over here to my office today, I didn't realize that this month is National Suicide Awareness Month. So all
There
the
we go.
schools have signs about that. And so I do want to take a minute to remind everybody of the 988 suicide emergency number. It's staffed 24/7. There's always a professional that can access help in your local area. And you just got to remember that there is help, and horrible things happen to us every day. You almost can't get away from it, and even if it's not in your immediate circle of family and friends, the fact that it's being blasted over and over and over, and not just at the 6 p.m. news like Walter Cronkite when I was growing up, but, you get those news blasts on your phone, and it may be for your mental health, you need to slow down those notifications. You don't have to have them pushed to you as they arrive. You can say once an hour, send me the notifications or something. That would help tone down. But like here in Pennsylvania yesterday, we had 5 police officers that were shot. Last weekend there was a national tragedy, and tragedies happen every day, and we're not going to be able to. I mean, it's part of life, part of being human, but it doesn't have to. The feelings that go with it are normal, but hypnosis and other types of holistic and traditional therapies can help you understand that your feelings are normal, that you're not defective, that it's okay if this is a pretty stressful situation for everybody. And there's some kind of, there's relief obtained when you realize that everybody is going through the same feelings you are. You're just not defective because you're having these feelings. But at the same time, though, I learned through some, very wonderful mentors over the years that sometimes, no matter how bad you're feeling, you still got to keep one foot in front of the other, and keep moving, because as long as you're moving forward, it may not be your best performance, but you're still moving. And if you get in the habit of not moving and pity parties and things like that, which is all part of human nature, you actually, it becomes easier to make excuses not to keep moving and, not to be successful. So self-hypnosis is a way that, and if you're just naturally using it, a byproduct is going to be a lower blood pressure and a lower heart rate. So if you happen to be on high doses of blood pressure medicines, heart medicine, it's important that you're monitoring this at home. And if you find that your blood pressure is now consistently much lower because you've learned to train your body to have a lower blood pressure, more relaxation, you need to let your traditional medical provider know that, I adopted this in my lifestyle and I'm wondering if I'm on too much medicine. You should never stop your medicine just because you see your blood pressure is low, but if you show a pattern, when you go to the doctor, all these low numbers, chances are he will put you on lower doses.
Right. And of course, if it's really low, you need to give them a call.
Absolutely.
We can't forget that. Yeah.
Yeah, but you should never stop your meds on your own just because you've discovered a technique that is lowering it and helping you. You just have to have open communication.
Yeah. Peggy, I know like when I do self-hypnosis, I do a lot of counting. Like I'll be walking upstairs and I'll be taking deep breath. I breathe a lot. I count. I
And
take deep
breathing is
breaths
good.
and I go upstairs. I count them too, purposefully counting them to relax. And I'll think of things like relaxing my shoulders and relaxing myself as I'm going up or down the stairs, but not my legs. Obviously, I need that. But you can do it laying down or whatever. So, well, I think maybe we should. I mean, these are some of the meditations I do. I do induction, which is counting from 10 backwards down to 1. It helps me to sink into being calm, and I tell myself with each number, I relax more deeply. And of course, I use visualization techniques, and being a holistic practitioner, you can imagine how many I do of that. I place my mind where I know, like under a palm tree at the ocean line, hearing the waves, and I'll just let the sound of the waves penetrate my body, and I'll go, I'll get into a really deep place, and I'll think of, what am I smelling? What am I feeling? Am I feeling the sand under my hands as I'm laying there? And I picture myself being there. It's so relaxing. And then when I get really relaxed, I'll say whatever I need to say for me at the time, which is common. I'll say something, I'm in a safe and peaceful place right now. And my body is calm, my mind is clear. And with each breath, I grow lighter and more at ease. And I grow, the stress just flies away out of my body. And then there's like an anchoring one. Sorry, I have a little mosquito. It's anchoring. Sometimes when I have patients and I do a little shiatsu or something, I do something to anchor them before they leave so that they drive safely home. But I'll have them do something like they'll listen to a little recording I have. It says, while feeling peaceful, press thumb and finger together. First the forefinger, then the middle finger, and I'll go down the line, and they'll hold it for like 3 seconds each one. And then I do have other techniques, of course I do as well. But then when I return back to their senses, it says count from 1 to 5 and repeat after me. When I reach 5, I will open my eyes feeling refreshed and relaxed. And then I'll have them stretch gently and open their eyes. And then I do a grounding technique with sound that really makes them feel like, oh, I'm back to normal, but
Right.
they're relaxed at the same time.
Yeah, we're going to take one more break. I will be right back. Thank you.
Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals. Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like, it was almost instant. Like, I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Hi, welcome back to this week's edition of The Holistic Nurse with Peggy Smith and Dr. Gloria Warren. We've been talking about hypnosis and a lot of that self-hypnosis, but if you're going to be considering, you don't think you have the skills on your own yet or the confidence, Gloria, why don't you talk about what a person looks for when they're looking for a hypnotist?
Right. Sometimes self-hypnosis, maybe it's just not enough for you. Maybe you want to have a professional help you instead, or, maybe you just want to see what other options you have. So you may seek out a professional hypnotist, and you want to get the right questions, because you want to be sure that you are going to the right person for you. It needs to be a good fit. So there's some questions that are involved, and one is regarding their qualifications and training. You want to ask them, what formal training or certification do you have? I mean, that's really the number one question, I think. And then, are you a member of any professional hypnosis organizations like NGH, ASCH, or IACT, or perhaps something else even that you can look into later? Have a little notepad with you so you can mark these things down. And then you also want to ask if you practice hypnotherapy for medical or mental health issues, and you also hold a healthcare license, such as a psychologist, counselor, social worker, physician, or a nurse. You want to know where they fit into the medical community too, especially if you're dealing with a chronic situation. Somebody that can talk to your doctor and your doctor can talk to them, and they can make sure they're doing the right practice on you. And then, for experience, how long have they been a hypnotist? How long have you been practicing this? And what percentage of your clients come for issues like my own, like anxiety or pain or whatever the situation? Can you describe a case, perhaps, of what hypnosis was effective for some or similar to my symptoms? And is this something you perhaps would, use on me? Then you want to ask them about their approach and method. What style of hypnosis do you practice? And this is, something we didn't get much into, but, there are the Ericksonians out there, and cognitive behavioral practitioners and regression. Maybe they like to do regression therapy, put you under and go to your past lives or your earlier life situations. And then which ones would probably be appropriate for your condition? Let's say you already know your condition. So you can ask them and see what they would want to do with you, because after all, if you come back, you want to be okay with it. Okay, so do you tailor scripts to each person, separately, or are you using templated scripts for this type of condition, and how is that done here? And then you want to talk a little bit about ethics and safety. Do you follow a professional code of ethics? Do you have it written down somewhere? I'm curious. And how do you handle situations with hypnosis that may not be appropriate or haven't been appropriate? And how do you, put them back on the right path? What do you do? Strong emotions and strong memories come up during a session. I mean, to me, this is a very important thing. So maybe it is to you, maybe it isn't. You want to talk practical details. How long are the sessions? How many are usually recommended? What is your fee structure? Do you offer packages for treatment? Do you provide recordings or self-hypnosis tools for practice at home? Recordings may be something you want to listen to later. Maybe that's a reassurance to you, and you can review what they did, or maybe they don't offer it in that It all depends what you want. The red flags to look for, though, are guaranteed cures. Oh, I can fix this in one session, That's a little steep, and I don't think anybody should claim that, because not all patients are the same. Also pressuring you into multiple prepaid sessions like a package deal when they haven't even seen you or reviewed your situation, that type of thing. That's heed caution. That's all I have to say to that. If they refuse to work in conjunction with medical or psychological or other types of practitioners, that's something you got to consider there. Doesn't sound correct to me, at least, but I mean, maybe it's okay with you. Something to consider. And then lack of clarity about qualifications and professional background. If they don't know what their professional background is about and their qualifications, where they come from, that's a red flag. However, I don't remember, sometimes I'll say John Berg's School of Public Health or John Berg's,
Right.
I sometimes will confuse things, but that's because my mind's more on them, not me. So, take those things into consideration. And
Yeah, those are all very good questions, and they actually apply to anybody who's looking for any practitioner in traditional medicine or,
right.
unless you have a managed care policy and you don't get a choice with your doctor, you want to try to work with a professional that is a good fit for you.
Right.
Just had a lot of information, Gloria. I'm happy to have, it was a great show today.
Great to be here.
Any viewers have any questions that they want to leave on the YouTube page, we'll be happy to answer.
Yeah.
Any ideas or give you suggestions for where you live locally. Thank you for joining us. And if you've gotten some helpful information, please like and share us and subscribe. Every week we have lots of holistic type modalities, and there's no one modality that fits everybody. You've got to find what works for you and what gets the best results. So everybody have a great week. Thanks for joining us, and thanks, Gloria. You have a good week too.
Thank you.
Take care. Bye-bye.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, 1 p.m. Eastern.